Hi, Dr. Barr. How's it going?
Hi, Jenna.
What are we going to be talking about today? Peptides?
Always peptides.
Awesome. Today we're going to be focusing on peptides for joints and for back.
Oh, good topic. Okay.
Yeah.
Yes.
Can you tell me a little bit about the one for back?
All right. So I love KPV. It's a peptide that we use for back pain. There's a lot of research and studies on it so far, and it really works very well. So I like to combine that with other peptides that, improve the kind of like the outcomes, because if we do KPV, it's for inflammation and for pain. And that is like for osteoarthritis, for kind of like degenerative disease of the spine. Sometimes most of us have that, which is like we talk about it, like herniated disc, bulging disc, all these little kind of things that they tell you when you do an MRI. Most people have that as we age.
Yeah.
So this is a really good one that was studied for that, KPV. And that is a peptide also that has to be injected. So it's not an oral peptide.
Okay.
And I like to combine it with BPC and TB4.
Oh, wonderful. And how often do they come in for these injections?
So when somebody has acute back pain versus chronic back pain, acute back pain, we like to get them almost every day if they can come in for a week. And then we space it as soon as they start having improvement. And that happens usually within a few days.
Okay.
So when they get off the acute phase, we might get them like twice a week or once a week after that for the injections in the area. So we have an ultrasound, we feel the spine, we feel the areas where the nerves are coming out, and then we inject in this area. So it's a direct injection. They cannot take it at home and do that.
Okay, wonderful. That's awesome for back pain. How wonderful. And then the next thing is, what was the last peptide?
So the BPC and the TB4 are the other two peptides that we like because they work on muscle pain, muscle injuries, bone injuries, cartilage, tendons, and also helps with building up like the kind of fight against inflammation. So when people have an injury, they start having an inflammation. So our body needs to fight this inflammation to clear it up. And that's the reason most of people have the pain. So number one, when people have injuries, we reduce the inflammation by using, for example, BPC is one of the peptides that also reduce inflammation, but we put them on an anti-inflammatory program.
Oh, great. And that's for joints as well, so joint pain.
And then TB4 would do the same thing. TB4, TB500, and the combination of BPC and the TB4, we call it the Wolverine. Have you seen that movie?
Yeah, that's wonderful.
It's so cool.
So, and again, that's the same protocol coming in. They need
They need to come. Depends on the injury. We either see them twice a week or we see them every day if they're in a lot of pain. And once they get into a chronic phase, if they have not healed completely, then we might see them once a week, and then after that, once a month if they need to come in for touch-ups.
Great. So come see us for joint and back pain.
Yes. Hopefully you don't have any of that.
Exactly.